Now I would like to invite Dr. Ashish Sharma to deliver his talk on why innovation should travel from A to Z. Over to you, Dr. Ashish.
Is this the one?
So I request AV team to please display slides.
Yeah. So good afternoon, ladies and gentlemen, and thank you, Rohit, for having me here. Rohit sent me a message at 11 o'clock in the evening, or rather night, that Ashish, I want you to speak in this session which I'm organizing, and then I said, okay, give me a little time to think overnight that what topic I should be speaking. He asked, can you give me a topic? So the topic is why an innovation should travel from A to Z, and I'm so glad to see Prakyat. I am so glad to see another colleague of ours, who traveled from A to Z. So before I proceed further, these are my disclosures, and I do have proprietary and financial disclosures here to disclose with MI Redkin YNC. So what do I mean by A? I mean A means when a thought starts in terms of innovation in your mind. And what is Z? Z is where you have your product commercially available and you see in hands of people. And that is making some difference. Now the journey from A to Z is something which you need to travel. And when Rohit asked me that you should talk about it. So whether I am worthy of talking about it or not means I'm not sure. But probably we have had traveled from A to Z in some of the products that we could thought about it and we could commercialize it. And our first product was MI Redcam, which has started its journey in 2013 as A, and it's reached Z in 2015. And at present, on podium I say, it is present in 67 countries with 16 scientific papers published, and we have received patent last year. This is another device that we again traveled from A to Z, starting A in 2018 and reaching to Z in 2020. I would not take credit for this. I had a brilliant student of mine, secondary DNB student, who came to me, Nilesh. He said, sir, I want to develop a device which can really capture the angle images, because as of now we verbally say, but can we do this? I had a straight question to Nilesh, are you ready to travel from A to Z? Because I do not really believe traveling in between. Nilesh said, yes, sir, I am ready for that. And this is the picture on 14 September 2020 when we were packing our first commercial device to dispatch. And image which was captured with this device was a part of official journal of World Glaucoma Association, Journal of Glaucoma. So that was the kind of testament for the quality. So we have, as of now, 3 products which have traveled from A to Z. Now, the question is that why a product and innovation should travel from A to Z? What you need, if you are not a saint, then you need these 3 things: name, fame, and money. That's what predominantly every innovator is trying to travel along, except saints who do not worry about the last part, but majority of them, they do. Now what happens with predominantly majority of the time when I speak to students, postgraduates, early practitioners, P is a stuck point. P is a point which gives happiness, but it makes you stuck at that point because the journey from P to Z is slightly complicated. What I mean by P is presentation. You have a concept, you present it in India, you present it overseas, you get applause. You are happy. You sit back and relax. Second, your idea got published in a very good journal, high impact journal. You are happy seeing the journal being cited few times. Again, you sit back and relax. Then third comes when you are quite close, prototype. Prototype is somewhere, now things have started working. So a lot of people I see, they are happy with Jugaad. But when Nilesh came, and any student who talks about innovation, I have one point to say to them, that people have money. people do not have time to invest. So if you bring with a product, people will use it, pay for it. But if you bring a jugaad, less likely that somebody would be using it. So this was our first publication, 2016, after we filed a patent. You see a brilliant citation. It is cited by 89 co-authors across the globe, because that was something which was new, where we were able to image peripheral retina up to the ora serrata and pars plana as well. So that excited people. We could have been just excited that time and then stopped working. And see, this is the journey which has gone from the drawing board till prototypes. And then prototype was something which was published in Euretina. We had these brilliant images coming from the device which was at the prototype stage. So these are, I'm talking about, P. These were P's which were giving us happiness. But then we were quite close to Z, when we had our commercial model ready by the designer. But even when once you have the design ready by the designer, from that to Z accomplishment, which is a final product of you, sometimes there are changes. So we had ergonomic testing, we have a lot of other testings in various hands, various phones. Then final Z was accomplished and the design was slightly different. So as I said, again another P was there, even the product was not ready. We were everywhere. We were at academy, courses, World Ophthalmology Congresses. We could have been stuck at P again. But what happens, as I was mentioning in earlier slide also, from A to Z, if you are stuck at P, what you get? Name and fame. But what about money? So if you are not saint, what money can do? Money inspires you to innovate further. So you need to see that money, and that money comes only if you travel till Z. And what money does, which it has done with me as well, when during the COVID time, when our salaries were deducted. We were not paid completely. It became the secondary source of income for as a person to me. So we really talk about in our financial sessions, nowadays in ophthalmology conferences also, that you should have some second source of income keep going. So this could work in that way as well. Another point is, if you are stuck with publication and presentation, you can be forgotten very easily. And what traveling to Z does is, it creates an immortality of you. You live really long once you travel till Z. Now, another question is, can every innovation travel from A to Z? No. We are stuck with 3 innovations, not even at P. We are stuck at multiple levels. Means RIGS is my dream device. When people are, coming to a diabetologist clinic, they wear a glass, then glass takes a picture. Every 6 months, patient wear a glass. Then the images are transferred to a Bluetooth on your phone. Then AI works, and then you get an answer. So until unless home care comes, you will really not get any solution for diabetic retinopathy blindness. I'm quite firm about it. A lot of work has been happening, so we are stuck there. With the smartphone itself, we are trying to image where we can image even up to the pupil in one go. MI ROP pen at conceptual stage, where we can have this screening at every NICU level. So it's not something that every innovation can travel to Z. This is another innovation. We are very inch close to Z, which will be commercialized very soon. I'm not sure if you can notice. We learn in cornea, we learn in aqueous humor what happens, the aqueous current. So this is an anterior segment imaging device that we are coming up with very soon in 2 to 3 months, which will show you this kind of high quality images where you can measure, quantify inflammation at a very, very cost effective part. You see the anti-clockwise current, can you see here? All these vessels, all these cells. So journey begins with one step with A, and you definitely leave your footprint for really long if your foot really, really reaches to Z. So thank you so very much for having me here.